This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So UT Southwestern, we had obviously PM&R. We've had a residency program here since 77. It's been ACGME accredited since 78. It's one of the larger PM&R residency programs in the nation. So we have 9 per year. It's a nice broad curriculum, friendly learning environment. We get a varied patient population, which I'll go into detail in a little bit. And it's pretty hands-on. The residents get lots of procedures. So UT Southwestern, which you can't necessarily, I know we're in the South region right now and we're called UT Southwestern, but we are in Dallas, Texas. So we are associated with, it's a med school and there's some health professionals, but it's not associated with a undergrad college, which is kind of also tricky. But we're in Dallas. A lot of people live in the Dallas area or in the suburbs. There's a couple of residents in the past that have also lived in Fort Worth, which is about a 45-minute drive. There's lots of things to do. It's one of the largest cities in the nation. I guess I don't know which, it's in the top 5. It's about 6.3 million, I think, in one of the fastest growing parts of the country, Texas, and North Texas in particular. There's a lot of larger companies that have moved to the Dallas region recently, like Toyota, State Farm, the PGA Tour. So there's a lot of people coming in for students who are interested because their spouses need to find a job when they match into residency. It's a lot of opportunities here in the Metroplex. We have both categorical and advanced spots. We have 6 categorical spots and 3 advanced if you decide to do your internship elsewhere. This is just kind of an overview of the intern schedule. If you want to apply to the categorical program, you get to do some internal medicine wards and consults, emergency medicine, neurology, neurocritical care, surgery, which is also really unique because it covers trauma and burn. If you remember learning about the Parkland burn formula in med school, that you're going to be working at Parkland Hospital where the Parkland burn formula was created. There's also some MSK radiology during your intern year and PM&R clinics. So this is some pictures of the faculty because I think that's what a lot of you guys are interested, like what do the faculty and the residents look like? What do the training sites look like? So just silly things with the residents. So the faculty, although there's some residents in here too, have been doing. Dr. Afechka and Dr. Sin were in DC lobbying for AAPM&R, and then the picture down here has Dr. Kowalski, who is on the board of AAP, was also in DC lobbying. This picture on the left, bottom left, is from AAP just a couple months ago now in New Orleans. And then this is the 5K that we ran for the foundation. We were actually, UT Southwestern was the largest team that participated in the foundation 5K. And then Eric here was actually the fastest runner in the 5K. But unfortunately, some of the faculty slowed the times down. So we were not the fastest team, but we were close. This is a picture, actually myself, relearning how to do a research project. So it's never too late to relearn your pipetting skills. The picture on the bottom right is actually the last holiday party we had in person before the pandemic, but this was the ugly sweater contest with a few of our faculty. And then this was another foundation 5K run. We have like all the subspecialties in PM&R that you could ever dream of. We have pain and spine, MSK sports. We have pelvic floor, which is fairly unique, cancer rehab, brain injury medicine, peds rehab, wound care and burns is really big, again, because of the Parkland burn association there. And then we have spasticity. So this is just some pictures of the faculty and the different outpatient clinics on the UT Southwestern side. Parkland Health and Hospital Systems. Parkland is the county hospital for Dallas County. It's a super large county hospital. It's the nicest one you'll ever see. It just opened up in 2015. It has 800 plus beds, 200 plus ER beds alone. The top floor, the 17th floor, in the part of the picture is actually cut off is where the rehab unit is. So it's a beautiful view for the patients from the therapy gym. But this is where a majority of your training would be at Parkland, which is right across the street from the UT Southwestern Hospital. And it's on what we call like the medical campus. But some pictures of the hospital, you can see the rooms are nice and big. Not that I ever hope that you'd be a patient, but when you're seeing patients there, they're nice and big and modern. And all the clinics are here in the Anderson Clinic building, which also just opened up a few years ago. UT Southwestern has a couple of hospitals. There's the Zale Lipsche building, which is where the rehab unit is and where ortho is. And that's right across the street from that new Parkland hospital. You can see pictures of the therapists in the therapy gym. You get a few rotations over at Zale doing the inpatient rehab, and then you do some outpatient clinics there as well. The patient population at Parkland, since it's a county hospital, is, I'm going to go back so I can talk about Parkland. So because it's the county hospital, you work with a lot of underserved patients and under and uninsured patients. So it's a wide variety. You see a lot of Spanish speaking patients. I think Vietnamese is the second or third highest spoken language, along with a whole bunch of others. So you see a huge variety of patients. Parkland is actually the first place I saw scurvy, because I've seen 2 scurvy patients now, but you just see a lot of weird things that you learn the pathology about in med school and you think you'd never see it. Parkland also actually has a leprosy clinic. Again, like the very weird, odd things that you get to see at Parkland that's truly unique, and you won't be able to experience anywhere else. UT Southwestern is a coronary care academic center, so you'll also see a lot of unusual diagnoses. You see a lot of neurovascular cases from the neurosurgeons and stroke team. We have a whole bunch of moya moya patients, as one of the neurosurgeons is world renowned for surgeries for moya moya. We also see a lot of LVAD and heart and lung transplant patients. Clements University Hospital, also part of UT Southwestern, is the main medical surgical hospital, and you'll do some consults over there. It's a little bit, parts of it's a little bit older than the Parkland Hospital. It opened up in 2014, but then they added a third wing that just opened up a couple years ago. So it's also a nice new modern building. Some of your rotations will also be at the VA, both during your internship, if you do your internship with us, and then also through the PM&R and the spinal cord injury service lines over at the VA. You get to do lots of EMGs and injections over there. You also get to do both the inpatient and outpatient spinal cord injury units, which is a lot of fun. The residents get to learn about vents and vent weaning for some of the SCI patients over at the VA. Our PEDS rotations are over at Children's. You do some consults and clinics, and you also do inpatient PEDS rehab at our Children's House. And you also, Texas Health Resources, Presby Dallas, the community hospital setting, and it's just a short drive from where the main campus is, but it's a little bit further away from the Parkland and UT Southwestern. But it's also a really well-loved rotation, and you get to kind of learn how to be a little mini attending and learn more about billing and coding and what it's going to be like to be out in practice on your own if you wanted to be in private practice. These are some pictures from other clinical sites. So we have a lot of wound care, like I said, and hyperbaric oxygen chambers if you're interested in really high-tech wound care. There's also, like I said, sports and spine and procedures. We have tons of fellowships over at UT Southwestern. We have both an ACGME pain fellowship and a NASS spine and MSK fellowship. We have PEDS rehab and brain injury as well. The didactics are an 18-month didactic, so you see it twice during your PGY 2 through 4 years. We also try to make it more interactive with workshops and discussions and panels. We also have a separate MSK curriculum, and we have monthly grand rounds and journal club. Like I said, it's a really hands-on residency program. If you're interested in doing procedures, there's a ton of procedures. One of the old chiefs just graduated. I think he had something absurd like 70 or 80 spine injections that he had seen during his residency program. You get lots of peripheral joint injections, lots of spasticity injections as well. Some of the residents will help out on sports coverage. So obviously in Texas, high school football is a huge thing. So you get high school football coverage. Sometimes we cover the Texas Golden Gloves boxing tournament, and the residents have helped out with the U.S. Paralympic swimming trials in the past as well. There's lots of unique experiences. We have a global health experience that we do with neurology stroke, and we go to Ethiopia and teach about neuro rehab while the stroke neurologist teaches about stroke. And it's a well-loved event, and Dr. Gabroyans everyone loves, and the residents and some of the PM&R faculty are jockeying for who gets to go on the next trip already. It's been kind of postponed for COVID, and then now more because of the political turmoil in Ethiopia, but we're hoping to start it up for 2023. We have lots of research here at UT Southwestern. We're part of the burn model system and also the brain injury model system. We have an annual Shark Tank, so for residents can pitch their research ideas to win some money and funding for their research projects. Some of the projects in the past have been published on JAMA Network Open, and Dr. Kai, who's now a faculty member, actually submitted that same Shark Tank research project to the Foundation of PM&R and won a larger grant to help pay for his study. And then just to close out, last pictures of the residents, the faculty, again, trying to show the camaraderie and the environment here at UT Southwestern. It's super friendly. It's also, it's nice to have a large faculty and a large residency body, because you can hang out with a lot of different people and find someone who has your own unique interests for what you want to do. There's lots of wellness events that we have and social events. In the faculty, the top right, one of the faculty members, Dr. Gould, invites all the seniors to her house the seniors at the end of the year, and kind of cooks traditional Turkish food for them. And it's just a special thing that Dr. Gould does with the seniors. No, except for Dr. Bell, nobody else gets to be invited. We just, I think everyone's just really happy to be here and love teaching the residents from the faculty side, and the residents all get along and have a great time. I think that's it. So thank you for visiting with us tonight, and I will stop and open it up to any questions. What research? Oh, go ahead. So Dr. Kelsey is actually our Chief of Research and Development, so she's a perfect person to answer.
Yeah, so in terms of research support, we started this year. I started meeting with the incoming interns and all the residents to ensure that all the residents felt supported in whatever research endeavors that they are interested in, and making sure that they get connected with the right individuals to be able to write, whether it's case reports or do clinical research. So we have faculty mentors, we do the Shark Tank. We also have Dr. Newman, who has his PhD, and he is mentoring residents, and he joined us earlier this year, and he's fabulous.
We have, I don't know the exact number, we have roughly 50 faculty, and then core faculty at UT Southwestern in the VA, and then we have the 33 residents if you count the 6 interns. So I guess roughly almost 2 to 1. Yes, we still are involved with the Adaptive Sports Expo. Dr. Kasidanan and Dr. Smith run that. It's gonna, if you're in the Metroplex, it's going to be, I think September is the Adaptive Sports Expo, and it's going to be in person again at UT Arlington. Yes, we have it's a quarterly, I believe it's a quarterly, you think I would know. It's a quarterly ultrasound curriculum on Friday mornings, and the residents split up into little groups to learn ultrasound. And they also do it in the various clinics, both at UT, Parkland, and the VA. More into academic medicine. So we have lots of med students that rotate through us. We actually have we have quite a bit of UT Southwestern med students as well. They have a 2-week exploratory and then a potential 4-week one. And we have a lot of external rotators. So the residents get to do a lot of teaching. There's also teaching, like medical education and leadership opportunities within the UT Southwestern graduate medical education system for learning more about academic medicine. Are there faculty residents who are participating in the AMA? I don't, I'm sorry, Dr. Sin does. Dr. Sin is a representative for the AMA. I forgot exactly what her title is, but she does do a lot with the AMA. I don't think there's any residents right now that are actively participating in the AMA. Yes, DO students. So one, you don't have to take if you're a DO student, you don't have to take USMLE. I'll look at just plain COMLEX scores if that's all you're taking. You have to have a step 1 or a COMLEX level 1 score, but you do not necessarily have to have the second one in when you apply.
We can try to talk about fellowships. Oh, go ahead, Dr. Barker.
Oh, did I miss a fellow? Oh, EMRs is, we use Epic everywhere except for the VA.
We have about 5 minutes left.
Thank you. In terms of fellowships, I would say spine pain, and then also SCI. I'm applying for cancer rehab right now, and then sports.
Also some TBI with Audrey.
True.
Yes, yeah, Audrey did TBI. Let's see, Ronnie's doing SCI. There's a few people in the current PGY3 class that want to do SCI, which is highly unusual. Let's see. Changes made from the residency program. The MSK curriculum is one obvious one that I can think of. We wanted to pull out more, we wanted to get separate time to do more MSK sports education, so the separate curriculum occurred. Feedback, the residents have their own workroom at Zale, which was based on resident feedback. And it's a lovely, I call it a princess workroom, because there's a couch and apparently now a mattress, fridge and microwave and everything you could ever dream of in that room. But those were the two things that I can think of off the top of my head. We worked on like changes with sign out and kind of cross coverage and things like that based on resident feedback. What are some new changes that we're excited about? We're tweaking the MSK curriculum to be a little bit, I guess, a little bit more interactive and at a better time for all the residents. I'm really excited about what Kelsey's doing with research, honestly. I think making it much more personalized is much more accessible to a lot of residents who may be nervous about doing research or scholarly activity. So I think it's really helpful to have that personal touch. Those are the two main things. I have dreams of doing other stuff that hopefully will come down the pike soon, but I will not say it because I am afraid I'll be held to it. Opportunities to learn Botox. Yes, so there is a lot. There's we call it spasticity clinic over at Parkland, and then you do botulinum toxins with the kids on the peds rotation in UT Southwestern on that side. We have an annual spasticity day where all the various botulinum toxin vendors come in and they teach and they bring all their fancy toys, their virtual reality and their various models. And we also do a lot of intrathecal pumps, both baclofen and pain pumps. We have one of the largest programs in the nation with over 500 patients with intrathecal pumps at UT. So there's a lot of opportunity for spasticity management.
We have about 2 minutes left.
Okay, we actually have a spasticity fellowship that just got approved and funded. So it's not really, I guess it's ahead of your guys' time, but if you are interested, it is available. Yeah, so we are actually unique. You get your peds rehab exposure, your PGY2 year, and that's the inpatient rehab at Archland's house. And then you get 6 weeks during your second year, and then you get 3 weeks during your third year. It's probably why we usually have at least 1 or 2 people going into peds rehab a year at UT Southwestern. I'm sorry, I talk too much. I should let the residents talk.
just to add on, the other great thing about our program, oh, by the way, I'm Rahul. I'm one of the new PGY3s. Another great thing is the autonomy you get as a resident. That was a big attractant to the program for me because, you know, I think it's just important. My personal philosophy is that I want to have all the practice I can before I'm attending and I'm on my own. And I think this program gives you a great opportunity to do that, whether it's procedures or inpatient or whatnot. You have a lot of to kind of manage patients on your own and kind of try out your own sort of plan, you know, within the safe, you know, guidelines of attending, of course.
That's all the time we have tonight, guys. Thank you so much, UT Southwestern, for an awesome presentation.